Hi, this is Dr. Sanjay Kumar Choudhary. I am a senior consultant neurologist at Institute of Brain and Spine, IBS Hospital. Now I am going to talk to you about a stroke. Stroke can be because of either a disruption of the blood flow to the brain because of blockage or because of rupture of blood vessels within the brain. So it can be either ischemic or it can be hemorrhagic. Ischemic stroke accounts for about 85% of the cases, and 15% of all cases of stroke are hemorrhagic stroke. First, I will deal with hemorrhagic stroke. Hemorrhagic stroke can be either because of brain hemorrhage, because of rupture of the blood vessels within the brain because of high blood pressure, or because of presence of anticoagulants in the blood, which is either because of some other illnesses or because of any disorder such as kidney or liver disorder in which there is increased anticoagulation within the blood vessels. Apart from this, there is another more sinister, more serious cause of brain hemorrhage, and that is aneurysmal bleed. We call it subarachnoid hemorrhage. Brain hemorrhage can also happen because of either trauma or injury. In fact, the commonest cause of brain hemorrhage in adults is because of head injury. So, we can deal with hemorrhagic strokes because of rupture of the blood vessels within the brain by immediate diagnosis, adequate intervention, by proper evaluation and instituting therapy. One of the commonest causes of brain hemorrhage is hypertension. So control of the hypertension and other risk factors like drug abuse because of alcohol or because of such drugs as cocaine, amphetamine or ecstasy, they can lead to brain hemorrhage. Sometimes even LSD can also cause brain hemorrhage. So the important point is we have to control the blood pressure and ask to avoid all the drugs of addiction. And we have to manage the patient of brain hemorrhage according to the presentation. Diagnosis is done by CT scan or MRI of the brain. Sometimes we might have to go for MR angiography of brain to look for aneurysms or CT angiography, which will pick up the aneurysms. If aneurysms are seen as the cause of brain hemorrhage and subarachnoid hemorrhage, then we have to block those aneurysms either by doing a surgical intervention like clipping the aneurysm or by neurointerventional investigations by putting coils within the aneurysm. This is usually done following a digital subtraction angiography. We have in-house trained neuroradiologist for diagnosis and in-house trained interventional neuroradiologist for coiling. We also have experienced neurosurgeons who can do the clipping of the aneurysms if so indicated. With this, I would like to thank you.